Sustanon 750 mg per week represents an extremely high dosage of testosterone. It's typically used only by advanced bodybuilders or athletes seeking maximum anabolic effects. At this level, the compound produces dramatic physical changes while significantly increasing the risk of serious side effects. Understanding the full scope of what happens when taking this amount is crucial for anyone considering such an aggressive approach to performance enhancement. The blend of 4 testosterone esters ensures both immediate and sustained high testosterone levels, resulting in rapid and substantial muscle growth. Users often report gaining 2 to 3 pounds of muscle per week during the initial phase of the cycle, with continued growth throughout. The nitrogen retention and protein synthesis rates reach near maximum capacity, allowing for unprecedented recovery and muscle development. Dramatic increases in muscle mass and strength at 750 mg weekly. Sustanon creates an overwhelmingly anabolic environment in the body. Strength gains become exceptionally pronounced at this dosage. Many users experience 20 to 30% increases in lifting capacity within the first month. With progressive improvements as the cycle continues, the enhanced neuromuscular efficiency enables greater force production, while the accelerated recovery allows for more frequent, intense training sessions. Estrogen levels can skyrocket, leading to severe water retention, high blood pressure, and a greatly increased risk of gynecomastia. Many users develop noticeable breast tissue growth without proper estrogen management. The bloating can be substantial enough to mask muscle definition despite significant gains in lean mass. This combination leads to performance levels that would be impossible to achieve naturally. Acne outbreaks become severe for many individuals, often appearing on the face, back, and chest. Those genetically predisposed to male pattern baldness will notice dramatically accelerated hair loss. Finding the right balance is challenging. Too little results in estrogen dominance, while too much can crash estrogen levels, leading to joint pain, lethargy, and cardiovascular issues. Regular blood work is essential to monitor estradiol levels and adjust AI dosage accordingly. The psychological impact can strain personal relationships and impair judgment in social situations. Complete suppression of natural testosterone production, at 750 mg. Weekly dose completely shuts down the body's natural testosterone production within days. The hypothalamic pituitary testicular axis ceases function as the endocrine system recognizes the artificially high testosterone levels. This suppression is so profound that natural recovery without post-cycle therapy becomes nearly impossible. The testes atrophy significantly due to lack of stimulation. And restoring natural function after the cycle requires extensive recovery protocols. Hematocrit levels commonly rise above 50%, sometimes reaching 55% or higher. This extreme increase in blood viscosity requires regular phlebotomy to reduce the risk of thrombotic events. Some users must donate blood as often as every 4 to 6 weeks to maintain safe levels. Blood pressure often rises to dangerous levels due to a combination of water retention, increased red blood cell production, and direct vascular effects. Hematocrit levels frequently exceed safe ranges, dramatically increasing the risk of blood clots, stroke, or heart attack. Tendons and ligaments become vulnerable to injury as they struggle to keep up with the dramatic improvements in muscle strength and power. Joint pain becomes common, particularly when estrogen levels fluctuate. Some users experience unusual muscle tightness and cramps due to electrolyte imbalances and altered hydration status. Enzyme levels often rise substantially, particularly in users who consume alcohol or take other medications. Many users experience extreme mood swings, ranging from euphoria to deep depression. Sleep disturbances become common, with some individuals developing insomnia or night sweats. Cognitive function may be impaired in some users, particularly in tasks requiring fine judgment or emotional control. Kidney function becomes impaired due to the combination of high blood pressure, increased protein metabolism, and altered fluid balance. Severe estrogenic side effects, insulin sensitivity typically improves initially, but may deteriorate with prolonged use. Appetite increases dramatically, which can be beneficial for mass gain but problematic when trying to maintain leanness. These changes can complicate post-cycle recovery and lead to unexpected fat gain when coming off cycle. The dramatic physical changes and sense of well-being can create psychological dependence, making it difficult for users to return to natural training. The contrast between on-cycle and off-cycle states becomes particularly stark at this dosage. The aromatization of testosterone to estrogen becomes extremely problematic at this dosage. Some users experience sexual dysfunction if hormone balance isn't properly maintained. Testicular atrophy is severe at this dosage, with many users experiencing significant shrinkage. The skin becomes thicker and oilier, with some individuals developing acne on unusual areas like the arms and legs. Those predisposed to male pattern baldness will experience rapid hair loss, often with permanent effects. Body hair becomes thicker and darker, with increased growth on the back, shoulders, and other androgen-sensitive areas. Fertility is dramatically reduced, and some users may become temporarily sterile. Recovery of normal testicular function and sperm production can take many months after discontinuing use. Even with ideal protocols, some users may require temporary testosterone replacement therapy to transition back to normal function. Aromatase inhibitors become absolutely necessary at 750 mg weekly, but their use introduces additional complications. Many users never fully regain their natural testosterone levels after such aggressive cycles. Cardiovascular damage may become irreversible, with increased risk of hypertension and heart disease. Some users develop persistent endocrine dysfunction requiring lifelong testosterone replacement. The psychological dependence on high-dose cycles can lead to patterns of abuse and difficulty maintaining gains without pharmacological assistance. Aromatase inhibitor use must be carefully calibrated, based on regular estradiol testing. Blood pressure should be monitored daily, with medications implemented if necessary. Diet must be meticulously controlled to manage the metabolic changes and support the extreme anabolic demands. The psychological adjustment to being off-cycle can be devastating, with many users experiencing severe depression, lethargy, and loss of motivation. These changes, combined with elevated blood pressure, create perfect conditions for accelerated atherosclerosis. Long-term use at this dosage could lead to permanent cardiovascular damage. Pronounced androgenic effects. The androgenic impact of 750 mg Sustanon weekly is extreme. Users typically experience rapid increases in body hair growth, particularly on the back, shoulders, and chest. The muscle growth and strength gains come with severe side effects that can become permanent with prolonged use. This dosage should only be considered by extremely experienced users with thorough medical supervision and understanding of the risks involved. The potential for long-term endocrine damage, cardiovascular strain, and psychological dependence makes this an exceptionally risky protocol that should not be undertaken lightly. For most users, lower dosages provide nearly as much benefit with far fewer risks to health and well-being. Behavioral changes are more noticeable at this dosage. While some users report increased confidence and motivation, others experience severe mood swings, irritability, and uncontrolled aggression. Cardiovascular system, under significant stress, the cardiovascular system faces tremendous strain at this dosage. Lipid profiles become severely disrupted. HDL cholesterol often plummets, while LDL cholesterol rises substantially, creating an extremely atherogenic environment. Hematological changes in blood viscosity. Red blood cell production becomes excessive at 750 mg weekly. Liver and kidney strain. While injectable testosterone doesn't cause direct hepatotoxicity like oral steroids, the metabolic processing of 750 mg weekly places significant stress on the liver. Musculoskeletal system impact. The rapid increases in strength at this dosage often outpace connective tissue adaptation. Psychological and emotional effects. The psychological impact of 750 mg Sustanon weekly can be profound. The addictive potential of such high testosterone doses shouldn't be underestimated. Metabolic and endocrine changes. Metabolic rate increases substantially at this dosage. Users often report feeling constantly warm and sweating profusely, especially at night. The endocrine disruption extends beyond just testosterone suppression. Cortisol levels often become suppressed, while thyroid function may be altered. Sexual function and reproductive health. Libido becomes extremely high initially, but may become unstable as estrogen and prolactin levels fluctuate. Skin and hair changes. Sebaceous gland activity increases dramatically, leading to severe acne in many users. Post-cycle recovery challenges. Recovering from 750 mg weekly is exceptionally difficult. Natural testosterone production may take 6 to 12 months to fully recover, even with comprehensive post-cycle therapy. A proper post-cycle protocol at this dosage should include ACR-MIS, like clomiphene or tamoxifen, possibly HCG, to restart testicular function, and careful monitoring of hormone levels. Long-term health implications: repeated cycles at this dosage can lead to permanent health consequences. Practical considerations for use: managing 750 mg weekly requires extreme diligence. Blood work should be conducted every 4 to 6 weeks to monitor hematocrit, lipids, liver enzymes, and hormone levels. Inclusion: Sustanon at 750 mg weekly produces extraordinary physical transformations, but at tremendous cost to overall health.